Hi, thank you for joining me. Hi, welcome to my channel. This is Dr. Eric, pharmacist for 12 years now. Please like, share, and subscribe if you haven't already. Again, my name is Erica Onagbola. My main channel is Erica OnagbolaPharmD. That channel is where I talk about disease states, medications, and non-pharmaceutical approach to diseases, and I talk about what it's like to be a pharmacist, all of that. This new channel of mine talks more about Bible study. It talks about medications as well, but just a small pinch of it. My main channel is mainly where I have all topics of disease states, medication, side effects on that particular platform. This platform is mainly for travel, retirement living. It's more for relaxing, spiritual inspiration through Bible study. And I do sometimes talk again about small items that I feel are important in medication management of today's society. So I want to talk about RSV. I want to talk about who qualifies, the risk factor that puts one in risk of developing RSV. And I do want to talk about risk factors that can qualify a person and when that person actually should get the vaccine. So the RSV virus is more prevalent during the months of October or fall season in the States through March, which is like more spring. So fall to March is when RSV virus is more going to be prevalent. And so the vaccine should be given during that period. Okay, so what qualifies a patient? Let's start off with who is at risk for RSV. First, there are two categories: those who patients who are in the hospital for some time, and also infants who are in the hospital for some time. Those patients qualify for the RSV immunization. Also, those patients who are hospitalized and those patients who are intubated. When I say intubated, that means that the doctor or the ICU department, they actually, or those who are undergoing a important surgery for inpatient, for example, who are going through anesthesia, those patients are intubated with a tube that goes down the esophagus to help with breathing. Those patients who have ever been in the hospital as an infant or those who are in the hospital and are intubated are at very high risk for developing this respiratory virus, and they qualify for the vaccine once they are in the categories that I'm going to mention. Okay, first category are infants. Infants qualify for RSV, especially if they are high risk. Infants who have been intubated, infants who are hospitalized, infants that are staying in the ICU or the pediatric ICU department, infants that are in the hospital ongoing. Those are the ones who qualify for RSV. Also, it's good for those women who are pregnant. Those women who are pregnant are at risk for developing RSV and should get the vaccine. It's a once in a lifetime vaccine. So that one pregnancy qualifies the mother to receive the vaccine. Now, if she's pregnant again and again, then the infant should receive the vaccine, not the mother, because she's only had her one in a lifetime dose. The infant now should go to the doctor's office after birth and get a RSV vaccine in the doctor's office with a special manufactured RSV formulation. There are two qualifying. I won't go over in this video because I'm just talking to the general public, healthcare professionals. They do know, as pharmaceuticals, nurses, physicians, we also have the specifics on which vaccine is given to each specific population. And so, again, every pregnant female should get one dose, and then the infants following each pregnancy after birth should get the vaccine up to 8 months after birth. The next group that qualifies for the vaccine are elderly patients who are 75 years of age and older. Those who are 75 years of age and older qualify no matter what risk they don't have. Anyone who is age 50 to age 74 qualified, but you must have a risk factor such as a body mass index greater than 40, which equals to someone who is obese or overly obese. And also, another risk factor is going to be someone who is dealing with AIDS or HIV in the age range of 50 to 74. And then another age group is going to be those who are also going to be dealing with, I want to mention those who are dealing with diabetes, also 50 to 74 years of age, and then those who are dealing with heart, lung, or kidney disease. Also, the last group are those who are 50 to 74 and they live in a end of life care facility like a hospice care or nursing home, or they are in chronic care and they're going to be there for quite some time. So, those are the ones who do qualify for the RSV. It's not readily available if you are in the age range of 18 to 49, unless you are again pregnant for the first time and ready to receive the first dose. So it's very specific, and these indications have been researched and have been studied because of the virus itself being more prevalent, more prone to cause negative outcomes. And so that's where I want to suggest that if you qualify, talk to your doctor. If you're about to enter that age range and you have organ system failure or have been diagnosed with a cancer or you have been diagnosed, you can still ask about your um, your chances of getting the RSV, especially if you are someone who is 50 to 74 and you have cancer risk or you've had previous cancer or you are on the verge of diabetes, pre-diabetic, or you have high blood pressure or you've had a previous heart attack or you've had a previous lung disease of some sort, then it won't hurt to ask your doctor or your pharmacist to give you a brief update about that. So that's what I want to talk about on this video. I'm Dr. Erica. I'm your pharmacist in charge. Thank you for joining me. I hope to see you on the next video. Bye-bye.